Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've talked about staring into the abyss of death when your loved one is critically ill in intensive care. You can check out last week's blog by clicking on the link below this video on our website. In this week's blog, I want to share with you why truth can be a thin concept when your loved one is critically ill in intensive care. Before I get into today's topic, I want to share a quote that I wrote on today's topic, and the quote says, "The truth in a challenging, difficult and heartbreaking situation is often not dependent on circumstances. The truth in a difficult and challenging situation is often dependent on the meaning of a situation and the meaning we attribute to it." Unfortunately, all too often, families in intensive care listen to the expert view of the intensive care team without second-guessing their views and opinions and without doing their own research. Families in intensive care are too carried away by their emotions and by the perceived power and by the perceived authority of the intensive care team without looking for their own truth. Truth can be a very thin concept, especially when it comes to the critical illness of your loved one, and families in intensive care should never underestimate their own level of power, control and influence if they have the right information at hand, if they continue standing up for what they believe in, and if they challenge the assumption of expert teams. So, let's go into today's topic. If your loved one is critically ill in intensive care and is facing one of those challenging and difficult situations where they are either very unstable and in a very critical condition, they are in a life-threatening situation, they're in intensive care for long-term treatment and long-term stays, or they're having a severe or traumatic head or brain injury, or your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Your loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one. Or, worst of all, your loved one may be approaching the end of life in intensive care. The truth of the matter is that sooner or later you are facing the truth of the situation. And if you are, like 99% of families of critically ill patients in intensive care, you are facing the expert truth of the intensive care team. This expert truth of the intensive care team will give you the facts and the figures, and it will always give you their expert view of what needs to be done. This often involves a one-sided communication style that most of the time doesn't leave you with much of a choice. There is little room for discussions as the intensive care team is trying to quote-unquote sell you their truth to you. This often happens in family meetings with an often overly domineering intensive care team. After all, they are the experts and they must know what's best, right? And if you and your family are like 99% of families of critically ill patients in intensive care who have no peace of mind, no power, no control and no influence, you go along with the expert truth of the intensive care team. You will just nod off everything what they say without second guessing. Very few families in intensive care are actually willing and able to challenge the truth of the intensive care team. It's often because they are driven by their negative emotions. They buy into the doom and gloom and the negativity of the intensive care team, and they have absolutely no idea that the truth of the intensive care team is often driven by what's happening behind the scenes in intensive care, and it's often driven by the intensive care team's financial interests and their financial budget constraints. It's also driven by their bed management interests. For example, would continue treating your critically ill loved one block a bed for other critically ill patients that the intensive care team perceives to be of a higher interest in treating them. The truth of the intensive care team is also driven by their medical research interests. For example, can your loved one be enrolled in a medical research study while they are being treated in intensive care? If they can be enrolled in a medical research study that, by the way, attracts 5, 6 or even 7-figure funding per year, they may get preferred treatment. And if they can't be enrolled in a medical research study, they may not get preferred treatment, and the intensive care team may therefore be overtly negative in your loved one's prognosis and diagnosis. If, on the other hand, your loved one can be enrolled in a medical research study, they may get prolonged treatment, even though your loved one is inevitably dying and suffering may be unnecessarily prolonged. Your job, as always, is to get to the bottom of your truth, irrespective of what the intensive care team is telling you. Your job is to do your own research, no matter the situation you are dealing with, in this once-in-a-lifetime situation that you can't afford to get wrong. And I can assure you that in more than 15 years intensive care nursing in 3 different countries, where I also worked as a nurse unit manager in intensive care for more than 5 years, I have seen over and over again that the families in intensive care who attributed their own truth to a situation and challenge, irrespective of the expert opinions and expert views of the intensive care team, those families had peace of mind, control, power and influence. Period. I can assure you that families of critically ill patients in intensive care who lived and stood up for their own truth, no matter the odds, often get preferred treatment for their loved ones. I'll give you a real-world example so that you know what I'm talking about here. A 72-year-old man that I looked after a few years ago in intensive care got admitted to ICU after open heart surgery. On the same day after he got admitted to intensive care, he had a cardiac arrest and he had to be resuscitated for more than 30 minutes. The gentleman survived his cardiac arrest and he ended up with an open chest for a few days. He also sustained a stroke and he went into kidney failure over the next few days. He was obviously placed in an induced coma and on a ventilator, and he required numerous drugs to keep him alive. Cutting a long story short, the intensive care team was trying to sell to the family of this 72-year-old man that a withdrawal of treatment and a withdrawal of life support would be in the quote-unquote best interest of their critically ill loved one. The intensive care team was quite adamant to issue a DNR, do not resuscitate, or NFR, not for resuscitation order quickly. The intensive care team in essence was trying to sell their truth to the family. This family in particular, though, was very different from the other 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence. And they immediately challenged the intensive care team's assumption and truth, and they immediately said that their critically ill loved one is strong, is a fighter, and that he will survive the ordeal. This family was adamant that their critically ill loved one can deal with adversity, setbacks and challenges, and that they wouldn't have it any other way but to continue treatment. The intensive care team was using pressure, and they were using their expert status as well as their perceived power and their perceived authority to coerce the family to agree to a withdrawal of treatment and to a withdrawal of life support, as they are obviously the only ones who know what is best. This family, however, stood up for what they believed in, and they were ready to get their loved one transferred to another hospital, and it was only then that the intensive care team realized that they were dealing with a powerful family who's very different from the 99% of the families of critically ill patients in intensive care who would just go along with whatever the intensive care team suggests. Again, with this man in particular, the intensive care team didn't want to invest the time, the money, as well as the physical and emotional resources it took to get this man to live. The intensive care team also knew that this man would block a bed for other potentially sick intensive care patients for a long time to come. The family, however, knew better and wouldn't budge. And after about 3 months in ICU, the man eventually got discharged to the ward after a long battle. However, it paid off. The family and the man himself were most grateful for his survival. They lived their truth, and they wouldn't have it any other way. They weren't intimidated by the perceived power and by the perceived authority of the intensive care team, and they would just stand up for what they believed in without worrying about any repercussions. They made meaning out of this dire and challenging situation, and they started to manage the intensive care team, and they reaped the results. Families stood their ground, knowing all too well what the interests of the intensive care team really were, and they positioned themselves accordingly, and most importantly, powerfully, irrespective of the intensive care team's hidden agenda. The family's truth was stronger than the truth of the intensive care team, and it's a good example that if they can do it, that you can do it too. So how do you do that? How can you get your own truth quickly and get peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. Or you can call us, find phone numbers on our contacts tab. Also, check out our product section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.